Xeroderma pigmentosum (XP) is a rare autosomal recessive genodermatosis caused by mutations affecting the nucleotide excision repair (NER) pathway, which is responsible for repairing DNA damage induced by ultraviolet radiation. Due to this defect, individuals with XP are unable to effectively repair UV-induced DNA lesions, leading to severe photosensitivity, abnormal skin pigmentation, and a high risk of early-onset malignant skin tumors. In some cases, the disorder is also associated with progressive neurological degeneration, reflecting the systemic impact of unrepaired DNA damage.
In terms of genetic mechanism, Xeroderma pigmentosum or XP is inherited through an autosomal recessive pattern. This means a child must inherit two mutated copies of the gene, one from each parent, in order to develop the condition. The parents are usually carriers and do not show symptoms because they still have one normal copy of the gene. The main genetic problem in XP involves a defect in the nucleotide excision repair pathway or NER. Normally, this system is responsible for repairing DNA damage caused by UV light from the sun. When UV light damages DNA, the NER pathway identifies the damaged section, removes it, and replaces it with the correct DNA sequence. In individuals with XP, this repair process does not function properly due to mutations in several genes such as XPA, XPC, XPD, XPG, XPF, and POLH. Each of these genes plays a role in different steps of the DNA repair process, so a mutation in any one of them can disrupt the entire system. Because the NER pathway is impaired, UV-induced DNA damage, including lesions like cyclobutane pyrimidine dimers, is not repaired. This damage gradually accumulates in skin cells, especially with repeated exposure to sunlight. Over time, the accumulation of unrepaired DNA damage causes cells to malfunction. Some cells may die, while others may continue dividing with damaged DNA, increasing the risk of mutations and cancer development. There's also a variant known as XP variant or XPV, which involves mutations in the POLH gene. In this variant, DNA repair is mostly normal, but the ability to bypass DNA damage during DNA replication is affected, leading to slightly different clinical features.
So when discussing the symptoms of Xeroderma pigmentosum, it is important to understand that they mainly affect the skin, eyes, and nervous system, and they usually begin early in childhood due to extreme sensitivity towards UV radiation. So the first one is skin symptoms, which are the most prominent symptoms of Xeroderma pigmentosum. Patients experience severe photosensitivity, meaning that even minimal sun exposure can cause damage. Children often develop intense sunburns, blistering, and redness after a short period outdoors. Over time, repeated UV exposure can lead to dry, scaly skin, which are called xerosis, freckle-like pigmentation called lentigines, and lastly, telangiectasia, which are visible dilated blood vessels. So as the condition progresses, the skin may become thin and atrophic, and patients have a very high risk of developing skin cancers such as basal cell carcinoma, squamous cell carcinoma, and lastly melanoma, often at a much younger age than the general population. Next is eye symptoms. So the most common eye symptoms include photophobia, which is an extreme sensitivity towards light, as well as dry eyes due to impaired tear production. And lastly, chronic UV damage can cause keratitis, which is an inflammation of the cornea, which can lead to pain and redness. In more advanced cases, patients may develop corneal opacification, where the cornea becomes cloudy. This can lead to visual impairment or even blindness if not properly managed. And last but not least are the neurological symptoms. So while not all Xeroderma pigmentosum experience neurological symptoms, but when present, they are usually progressive and severe. These symptoms may include loss of reflexes, poor muscle coordination, hearing loss, and even difficulty with balance and movement. Some patients experience microcephaly, where the head size is smaller than normal, and cognitive decline such as loss of thinking and learning skills. These neurological features occur because DNA damage also accumulates in nerve cells, which cannot be easily repaired or replaced.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Sumaya binti Hamzah from Optometry, student ID 2025417528. Today I will explain how xeroderma pigmentosum or XP is diagnosed. XP is a rare genetic disorder that affects the body's ability to repair DNA damage caused by ultraviolet radiation, which is UV. First, clinical evaluation. Diagnosis often begins with observing early clinical symptoms. Individuals with XP usually experience severe sunburn after minimal exposure to the sunlight, along with extreme photosensitivity and early freckling, especially on sun-exposed areas on the skin. This early sign raise suspicion and prompt further medical investigation. Second, follow-up medical checkups. Regular follow-up examinations are very important for patients suspected with XP. These include routine skin and eye examination to monitor changes such as pigmentation abnormalities or the early development of skin and ocular cancers. Continuous monitoring allows for early diagnosis and better management of the condition. The third one is genetic testing. Genetic testing is used to confirm the diagnosis. A blood test or skin biopsy can identify defects in DNA repair mechanism. For individuals with a family history of XP, prenatal testing and genetic counseling are available. These tests help to determine carrier status and identify specific XP subtypes. In conclusion, early diagnosis of xeroderma pigmentosum is crucial to prevent severe complications. A combination of clinical evaluation, regular follow-up, and genetic testing plays a key role in managing this condition effectively.
The goal of management of patients with xeroderma pigmentosum is to decrease the number of malignant tumors the patients develop, early detection and treatment of malignant tumors, and to increase the patient's quality of life as much as possible. The most effective methods of decreasing the number of malignant tumors in patients with xeroderma pigmentosum is strict sun avoidance and protections. Patients and their caregivers should be educated on all strategies to keep UV radiation exposure to a minimum. Patients should avoid going outside of their homes during daytime hours. If they must go outside during the day, they should be covered head to toe with sunscreen. Broad-spectrum sunscreens requires applications every 2 hours. Patients should also use a lip balm with sunscreen. Patients should wear sun-protective clothing with long sleeve and pants. Patients should also wear hat and sunglasses with side shields. Every windows of the homes, cars, and school should be covered with UV blocking films. Patients should also avoid exposure to fluorescence, metal halide, and halogen lighting, which can emit UV radiation. Given the strict sun protections and avoidance, patients should also take vitamin D supplementations regularly. Patients can also obtain vitamin D by eating vitamin D-rich foods such as fish, eggs, mushrooms, and fortified foods. Regular total body skin exams should be performed by a dermatologist as well as by caregivers. Patients should see a dermatologist at a minimum every 3 months throughout the patient's life. Caregivers should perform daily skin exams at home and receive educations on changes to bring to the attention of the patient's dermatologist. Actinic keratosis should be treated as early as possible after the presentation to decrease progressions to squamous cell carcinoma. Radiation therapy is to be avoided in patients with xeroderma pigmentosum. Malignant melanoma should have treatment with wide local excision with possible sentinel lymph node biopsy. Patients with metastatic disease should obtain a referral to hematology or oncology for further workup and treatment. Xeroderma pigmentosum can also be treated by gene therapy.